In-depth coverage of the top stories and breaking news when it happens. News Radio 1080 KRLD.
You know, there's been, of course, a lot of people who have had coronavirus, but they don't necessarily need to go to the hospital. They're being told just stay at home, quarantine. But other people are doing all they can to keep from getting the virus. And today's Ask the Expert, we're joined by Judy Gaman. Now, she is the author, health and wellness expert, and the CEO of Southlake Executive Medicine in Texas in Southlake. And welcome to the KRLD Afternoon News. We're always interested in knowing what are some of the best practices or things to keep in the house to kind of boost your immune system, especially during this time.
Well, there's a couple of things we've actually had our patients on for a while, and these are just staples, and that is vitamin D, 5,000 IUs. We have a vitamin D crisis in America. We are really low on vitamin D, and so we should be taking it. And so we've had a lot of our patients on vitamin D 5,000 for quite some time. And interestingly enough, the research shows that people who had a normal or above normal level of vitamin D in their blood, serum levels, those people did not get sick. And there was another study that came out that said the people that were in the hospital that were very, very sick, the ones that they did introduce the vitamin D to, actually had a higher rate of recovery. So we know vitamin D. Another good one is zinc. And zinc is really good. You can get it in pumpkin seeds. You can get it in natural sources. Right now, during the pandemic, we're telling our people, get on about 54, no more than 60 milligrams of zinc. All of this boosts your immune system, and lay off the sugar. Lay off those kinds of things, sugar and artificial sweeteners, all these things that tend to hurt your immune system. Just do the things that help it.
Also, vitamin C. It's part of my diet every day is that we've been taking the vitamin D, as you said, also the zinc and a vitamin C as well. Does this work as a preventative, not just for COVID, but for other diseases as well?
Well, yeah. We know that this was a great way to prevent even the common cold. It's something that we should all be doing during flu season. But a lot of times when you go to the doctor, they don't even mention some of these very easy things that you can do. And vitamin D and zinc, these are very inexpensive supplements. And like I said, there's a lot of sources you can get these in your food. And you need to just be very aware that nutrition during flu season, during this pandemic, during any time when you're going to be under stress and be taxing your immune system, your nutrition should be good, very good. It should be great.
Now, we have seen kind of the bad side of health advice during the pandemic, a lot of scams going on when it comes to certain types of preventatives of COVID-19. Have you had to dispel any rumors with your patients of taking maybe a certain amount of something or another, or some type of supplement, anything that that has been on your radar?
Well, absolutely. I always say, and we always tell our patients, beware of infomercials and things out there that are promising the moon. There is no cure for the coronavirus that you're going to get some kind of cure supplement or you're going to get something off the internet. If you see that, run. Really, right now, the best thing is the social distancing. And also, we're rolling out the vaccine. Get the vaccine. I had the vaccine. I feel better, actually, than I felt in a very long time. And I'm on day 16 post-vaccine. So get that vaccine. And if nothing else, even if you were never going to come in contact, the peace of mind that it gives you, the stress that it relieves you of that maybe was very subconscious, in and of itself will help you be healthier.
Judy Gaman, thank you so much.
Always a pleasure.